Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell. R3 is the nation's leading provider of regenerative medicine services with over 10,000 successful procedures performed at over 30 centers of excellence around the country. Okay? The topic today is why a bone marrow stem cell procedure is a terrible idea for anyone over the age of 50. And here's why. There's two things that you need to think about when you're considering having either an amniotic or an umbilical stem cell procedure versus a bone marrow procedure. Okay, the two things are as follows. When we're born, 1 in 10,000 cells in your bone marrow is a stem cell. That is a large number. That's a lot of stem cells. Okay? By the age of 70, that 1 in 10,000 drops to 1 in 2 million. So the number of stem cells that you have available in your bone marrow goes off a cliff, exponentially dropping, and that's a problem. Because if, as someone at the age of 70, you can't give all of your bone marrow, that would be fatal, to have a procedure done, and it doesn't matter how many times it gets spun, you just can't get enough cells to make a difference. And it's not just the amount of stem cells, it's also the amount of cytokines and growth factors and all the other regenerative cells that your body uses in the process. All right? That's the first thing to keep in mind. The second thing to keep in mind is that just because you are 55 by the clock, chronologically, that does not mean that you are physiologically 55. Any risk factors such as smoking, drinking, more and more medications that you take, other medical problems that you have, these types of things are going to potentially inhibit the ability of your bone marrow to produce stem cells and other regenerative cells. So that what's available to you might be much lower than what you think because, oh, I'm 55 or I'm 45 or something. What you really want to think about is your physiologic age. Any of these risk factors, and let me go through them again. Let's see, smoking, alcoholism, obesity, more medical problems, medications. For instance, there are some types of medications that may inhibit the ability of your bone marrow to do its thing, to make stem cells and other regenerative cells. Okay, so there is a huge physiologic component, meaning that your chronologic age is usually much different than your physiologic age. Okay, and that's what you need to think about. Whereas if you're talking about an amniotic or an umbilical stem cell procedure, you're talking about something that is so consistent from one donor to another that you don't have that physiologic differences. All right, because everything is so consistent within like 5% of the cell counts. So that's one reason why over 98% of the prospective patients who contact our centers around the nation specifically ask for one of those amniotic or umbilical procedures. All of our centers offer a free consultation to see if you would be a candidate for a regenerative medicine procedure. Simply call us today at 844-GET-STEM. And we'll be happy also to send you our free consumer guide to amniotic and umbilical stem cell therapy. Just go to our website, r3stemcell.com, scroll down a little bit, and there'll be a picture of it. Just click on that, put in your email address and whatnot, and it'll be sent right to you. Thank you very much.